surgery. So another Facebook Live interesting case. Nice patient, 58, from the southeast, with one set of implants, 1998, because the silicone implants were banned. So she comes in with history of MS. Just the fact that she has MS, she should get her implants out, because you do not want to compound / complicate the symptoms that may potentially overlap with the autoimmune problem. So she has what is one set of implants, saline capsulectomy, 11526, initials DB. As you can see, she had a lot of inflamed tissue, hard, nodular, irregular fatty tissue that I removed. Some areas relatively very thin. Right here, as you will see, complete removal of the entire implant capsule. Now remember, so when she had her implants, they were placed much further up in the chest, like 2 finger breadths below the clavicle. When I saw her in clinic, her implant literally was all the way down here. So it is extremely important to remove the entire implant capsule, as we all know, but to remove the capsule all the way up in the upper part of the chest. That is as important as the capsule that's down below. So all of that needs to be removed completely, sincerely, all the way up into the upper part of the chest. And this is where, as you will see, there's more of an overlap, connective tissue, and all of it has been removed. Again, you will see how thin this capsular tissue is. So I'm going to cut through this. I did a lot of contouring. This is that pseudo lift. So between the recoil of the breast tissue, now that the implant that was gravitating the breast tissue down, between the excess skin removed, between the 4 layers of suture that moved the breast tissue inward and outward, and the fluffing effect, now that the implant is gone, the patients do aesthetically relatively very well, almost a year and a half out. So as you can see, as I'm cutting through it, here's this white type of a scar tissue that's present, and that's why if I touch it, you can see it's nodular, it's abnormal, and it's irregular. So as I cut through this, I'm going to cut into this capsular tissue right here, and you can see I can take my ruler and place it here, so you can see how thin this capsular tissue is all the way around. 100% of the capsule has been removed. Let me go in here. This is that very thin part, so we can see, you can see there's some fluid around it as well. Very thickened capsule. It's very slippery. What appears to be an overfilled implant. And you will see the crunchiness. So as soon as I go in, you will see, look at this fluid. None of this spilled into the chest. You can see very slippery and slimy. This is your number 6 mentor, and it says number 6 over here. What is an overfilled implant? You can see starting to break down. And as you will see right here, it has that crunchiness to it. And again, transparent thin. So complete entire implant capsule removed. No matter how thin, it has to go. And remember, that is the whole theme and goal of the surgery. And you can see this white crystallized speck. It might be over this area. Completely removed along with the implant and capsule. So this patient, nice patient, she liked the fact, do no harm. Remember, she had a lot of complaints of what is suggestive of what is breast implant illness. Left side, a lot more skin removed. And then you can see how thin the capsular tissue is right here. And actually, if I press, you can see the crunchiness that is occurring. Again, all of this tissue has been removed in the entirety, and you will see the crunchy capsule very soon. So I'm going to go in from here. Overall, the capsular spread is very large, and as soon as I go in right here, I'm going to remove this. You can see, look at the fluid around. You can see that stickiness. We'll come back to that in a second. As you can see, look at that stickiness. That's the silicone leaching from the silicone shell of the saline implant. And this is the same Mentor logo, the 2 arrows and then number 6 overfilled. And if I go like this, you will see and hear the crunchy capsule. This tissue, the fatty tissue, I have had to remove it because this is the same fatty tissue. It feels abnormal, looks abnormal, palpates abnormal, and you can see it's in the proximity of this capsule that's so ultra thin, and this is where this leaching phenomenon has spread to. And so that's why anything that feels abnormal, looks abnormal, you can see it's part of the capsule. And histology has shown analysis of this, that this is part of the capsular outer fragment. So it is not a discrete entity, but part of this inflamed tissue, connective tissue, right next to that capsular tissue. So the entire implant capsule, inflamed tissue, all three, implant, capsule, inflamed tissue has been removed, with only good, healthy, viable tissue remaining behind. Anything questionable, suspicious was removed. And this is that millimeter by millimeter dissection. Blood loss, 5 cc's on each side. And the implants will be returned to the patient, capsules to be sent to pathology, rule out the rare BIAL, CL, CD30 analysis, rule out lymphoma, rule out malignancy, rule out anything abnormal like breast cancer, cultures for aerobic, anaerobic, and fungal. And we'll see how the patient does post-op minus the symptoms that she had that were suggestive and consistent with what is breast implant illness. We will hear from her. Remember, there is no lab test, no imaging test. Ultimately, the only and one proof that she has that the surgery was done in the manner as described is when she looks at the chest wall pictures and videos showing complete removal of the capsule. This is also very important, but you have to put the 2 sets of videos together to make sense of the whole surgery. This is Dr. Khan, Executive Plastic Surgeon.